So a primary knee arthroplasty is a very commonly performed procedure that basically involves a patient undergoing a joint replacement for the first time round. So essentially the difference between that and a revision knee replacement is firstly, basically that you're revising and you're changing over a primary knee replacement to a revision knee replacement with the revision procedure. There are certain other differences from the point of view of the complexity of the procedure, certainly with regards to the potential, well, it really depends on the reason why the primary knee replacement is being revised, whether it be infection or loosening or instability, pain or stiffness. There's a variety of different reasons, which in turn adds to a level of complexity to revision knee replacement that, generally speaking, primary joint replacement doesn't have. It also adds to the time of the procedure, potential complexity of some of the implants that we use to do revision knee replacement as well. So there's a variety of different reasons, all of which really relate to the reason why revision knee replacement is being performed. It's not necessarily the case that someone who's had a primary joint replacement will inevitably need a revision knee replacement. It really depends on a number of different factors. Firstly, the age of the patient, because we know that younger patients tend to use the primary joint replacements a lot more, whether it be in their occupation or whether it be in terms of their hobbies or pastimes, whether they walk long distances, run, play sports, etc., etc. It's only natural that those kind of activities are going to wear someone's knee out a lot quicker. The likelihood of needing a revision is basically dependent on that, as well as other physical factors such as the weight of the patient and certain genetic factors or familial factors that may contribute to problems. A revision knee replacement, generally speaking, is necessary when the basic principles of joint replacement aren't being fulfilled, i.e. having a pain-free, stable joint with a full range of motion that you can fully weight bear on. Now, out of all those things I just mentioned, there's a variety of different causes that can cause a primary knee replacement to fail in one of those modalities, whether it be infection, loosening, sometimes fracture or periprosthetic fracture can necessitate a revision surgery as well. So all of those kind of incidences may speed up the necessity for requiring a total knee replacement revision. The benefits of undergoing revision knee arthroplasty really boils down to what the patient wants and what they expect. Essentially, by the time you come to needing a revision knee arthroplasty, most people will be happy with a stable, pain-free joint that you can fully weight bear on. Occasionally, it can get you back to other levels of activity, such as playing doubles tennis or skiing, or even walking long distances. Generally speaking, we wouldn't want someone to run or kneel on knee replacement, but the benefit of the revision knee replacement is essentially giving you another lease of life with regards to your joint, and giving you another 20 to 30 years of good stability, having a pain-free joint, and enjoying all the things you want to do in life. The short answer essentially is yes, primarily due to the level of complexity and the level of dissection that is required in extrapolating an already failed implant and then debriding, whether it be the soft tissues and the bone, and then reconstructing the knee with a variety of stems, augments, cement, and constraint built into the implant. That requires a lot of planning. And often this is done, and certainly I do this in my approach, with a multidisciplinary type of approach, with a very patient-centered basis. So We talk to the patient, figure out what they need, what they want to do in life, look at the x-rays and the imaging, collate all of this together, discuss it with a lot of my colleagues in a multidisciplinary fashion, and come up with some very good, robust, safe decision-making on how I proceed with the revision knee replacement.